Hi, we're going to talk today about the coronavirus from an ER perspective. So, we're going to talk about the common symptoms of the virus, when to go to the ER, what happens when you go to the ER, and why do we still need social distancing. So, what you're likely to feel initially if you have the virus is fever, body aches, fatigue, and feeling generally weak. Sometimes that's followed by cough and shortness of breath, and less common diarrhea. So, when are you supposed to go to the ER? The main symptoms that should take you to the ER is the shortness of breath. So, if you feel you're breathing hard, whether you're sitting, if you can't catch your breath on walking or going up the stairs, and having the symptoms of the virus, then you should go to the ER. Another symptom, if your family member is acting abnormally while they're sick, their behavior has changed. This is a concern that they're not having enough oxygen goes to the brain, and you should take them to the ER. Otherwise, as I said earlier, the main symptoms that we're seeing now is the fever and the body aches and feeling fatigue and weak, which we usually see it in patients with influenza and flu. And if you have these symptoms, try your best to manage at home with staying well hydrated, treating your fever with Tylenol, and isolating from your family and having self quarantine. Also, call your primary care physician, as many of them right now are doing telemedicine and they can help you over the phone. So, what happens when you go to the ER? When you first get to the ER, you gotta go through the triage process where you're gonna be met with a nurse and likely a technician. They will take your vitals, which will include your blood pressure, your heart rate, your respiratory rate, your oxygenation, and your temperature. Depending on your vitals and the severity of your symptoms, you'll be taken to a certain area in the ER where you will see a doctor or a provider. They will assess you, and depending on that, you'll either be admitted to the hospital or discharged home. At this time in the ER, we're only testing patients that have severe symptoms and get admitted to the hospital. So if you have mild to moderate symptoms that is likely to be managed at home, you will not be tested in the ER for the coronavirus. So at this time, we're only testing patients that have severe symptoms. One thing that I want to touch on also is family members that come with the patient are likely not allowed to be in the ER with the patient, or even if they're admitted to the hospital. And it's mainly because we're trying to limit the exposure as much as possible, and also um, we're getting busier by the day, so we're trying to limit the number of people that are in the ER. So why do we still need social distancing? It's the main measure that we have to slow down the virus. I was asked when first the pandemic have started, why or how is it different from another virus or another pandemic? How is it different from the flu or influenza? And in the past, we've seen viruses that spread fast, but they're not serious, or they are serious, but they don't spread fast. The coronavirus actually is spread fast and it's serious. And if we don't take the right measures to slow it down, it will overwhelm our hospital system and we cannot care for the sick. So please practice social distancing, stay healthy, and be safe. And I hope this was helpful. Thank you.